The cost of IT in business can be staggering. From hardware and software expenses to services like internet and phone, you don't need to spend a fortune on IT to succeed. If your organization spends more than $500 monthly on any service, or you're considering signing a long-term contract, IT Enabled can help you manage your technology and minimize your costs. Contact us today to schedule a free consultation. IT Enabled, we're here to help.
Hi, I'm Tara Watson-Watkins, President and CEO of the Lufkin, Angelina County Chamber of Commerce. Welcome to the Connect podcast, connecting business to the community. I'm here today with my co-host, Blake Pollino with VP Media Group.
Welcome back to the show. We are so excited to have you listening again this week. And this week we have Brenda Walker with The Rose, an incredible organization that's doing so much for women's health. And there's incredible opportunities that are available in this podcast. Please make sure you listen to this, share this with somebody. It's such a great episode. So let's get into that now.
Brenda, we're thrilled to have you on the podcast. Welcome. It's your first time on the podcast.
Yes, thank you for having me.
You're welcome. Why don't you tell the listeners a little bit about you, and then we'll talk about the Rose.
Okay, my name is Brenda Walker, and I'm the Community Engagement Navigator for the Rose here in the East Texas area. I live in Woodville, but travel to Lufkin and to all our sites. And I've almost been here almost a year, so this is a new adventure.
Nice. Are you from Woodville? Is that home?
Yes.
Okay, born and raised there.
Well, not born, but raised there.
Okay, good. Well, why don't you tell us about the Rose? What is the Rose?
Okay. Well, the Rose is a nonprofit organization dedicated to making sure that women get their breast health needs taken care of in the most convenient, easily accessible way that they can. And they were founded in 1986 in the Houston area by Dr. Dixie Malillo and Miss Dorothy Gibbons. And from there, it just blossomed, and it was just such a great need. And for this area, they were traveling from Houston, coming here, and it was just, they were having to lug heavy equipment around and all this type of thing. And then the staff was having to come from Houston and sometimes stay overnight. Mm-hmm. And they just couldn't reach people the way they wanted to. And so a couple of years ago, through an anonymous donor, they were able to purchase a coach that is dedicated just to the East Texas area. Wow. And so that coach is our medical mammography station on wheels, basically. We bring the mammogram to you.
Nice. And
in this rural area of East Texas, there's so many doctor's office employers that use our service, and the women are just thrilled. It's just such an easier, a more convenient way. And also we have, we don't forget the uninsured woman, and that is one of the great things about the Rose. We have programs for women who don't have insurance. Okay. And so we always try to incorporate that in every site.
That's great.
I'd love you to tell us more about that. So for people who have insurance, this is a preventative care, right? So you can come and do that. And I assume that's, I've never had a mammogram before, so I'm not well versed in this. Not the best person to probably talk about it. Yes, so I've heard. So tell us, if you have insurance, around about what does it cost, and if you're uninsured, what does that program look like?
Most insurances cover mammograms as a annual screening, and so it's a preventative benefit, and usually it's at zero cost. Now there are a few insurances that may have a copay, and so the woman would be responsible for whatever her copay is. But for every 3 insured women, that allows us to offer services to 1 uninsured woman. And so this is based on income. There's an income guideline, but it's pretty high. And they just have to fill out a form, of course, and there's bring their proof of income. And all that will be taken care of before the day of their mammogram, so that they know that they're approved and everything. And that grant, it's a grant that helps cover the cost of that. And so we go all the way from, I say, from Hampshire Finette to Henderson, and the women in between there, that are uninsured, we just encourage them to apply.
And do you have to have a physician to refer you to this?
You do have to have a doctor's order, and
Okay.
the reason is because at the Rose, we just don't want to give you a mammogram. We want to make sure that there's follow-up.
Okay.
So the PCP will write the order for the mammogram, and then if when the results come in, we send that to your PCP, and also the participant gets the results. And if there's a finding, then we know that woman is going to be taken care of.
Right.
Through the treatments, whatever might be necessary. So without that PCP to help us facilitate those orders, someone may have a diagnosis and not know it, or
Right.
not follow up with it. So that, we don't want to just say, here, come get your mammogram. No, we want you to follow through, and we want to make sure that you're in the healthcare system. And we actually have a program that is called Medical to Mammogram Home, and we have a nurse practitioner that will come out to a site if we have women don't have a PCP that need a mammogram, and she'll go over, have an examination with them, go right there on the coach, and try to link them up with PCPs in the area that we're in.
Okay.
So that they do continue with the follow-up. But so that no woman uses that as a barrier, we have that program available too.
That's great. So I know, like, when I get a mammogram, I'm looking for the best mammogram that there is. So 3D, 4D, what can I have? Do you have things like that?
All
available?
we do now is the 3D. That's
Okay.
what's considered the standard of care.
Okay.
Anything less than 3D is not considered standard of care. And that's what we offer on the coaches. At our centers in Houston, they have a lot more diagnostic services available. But on the coach, we only do 3D.
Okay. And then do you do like the ultrasounds at all if you were to have that, or is that where you would have to go to Houston?
Right, you'd have to go to Houston. We don't do that on the coach.
Okay.
And also on the coach, because it is a screening mammogram, if you have some type of problem, a lumping that you found in your breast, or pain, or something that's not quite right, you don't want to just have a regular mammogram.
Right.
So your doctor will need to know that, and you won't be seen on the coach for that, because it's a screening type mammogram. So anything a little bit deeper, you need more diagnostic type mammogram.
So this is wonderful for women who need a baseline mammogram to know where they stand, a yearly mammogram that's going out there.
Yes.
And what age do you recommend that women start getting mammograms?
By age 40, some insurances will allow women to have their mammogram a little bit earlier, as early as 35, but at least by age 40. And we recommend every year, because just in a year, changes happen in your body. You
Absolutely.
know that. And the slightest change could be detected by the 3D mammogram, and that will allow your physician to coordinate care and for women to seek out treatment.
That's great.
That's wonderful. And so you talked a little bit about employers and different places being able to host these. Tell us a little bit about that. A lot of our listener base is local to here, and our business owners or may have the opportunity to host you for this type of event. How does that work?
Yes, it's not just doctors' offices. We go to a lot of ISDs, banks, community centers, churches can even host a day, and it doesn't cost anything for the coach to come. The only thing we require is that there be 20 women pre-registered.
Okay.
And sometimes that's an online registration, like with a community event. The woman will have the access to the online registration information, and she'll do all that herself. The paperwork will be done ahead of time, and she'll come for a mammogram, and 15 minutes she's in and out of there. At a doctor's office, it's a little bit different because they already have the records. And so we work with them to work their schedule and get their paperwork and stuff turned in time. And usually we like to give sites about 6 weeks. That gives them from the time that 6 weeks from the time that we start working with them until their mobile date. And that gives them about 4 weeks to fill the schedule, and then 2 weeks that we fine tune the paperwork, verify everything, see if anything's missing, and give us time to get all that together before the actual mobile date, so that when we come that day to their site, the women are ready to go, and everything's, it's like
Seamless.
I said, 15 minutes and they're in and out.
Yeah. You can't go to a doctor's office for 15 minutes to get a mammogram.
And the nice thing about having your mammogram done on the coach is, especially at your employer, you don't have to take an entire day off. You don't have to rearrange your entire schedule.
Yeah.
You don't have to have someone else pick up the kids. It's at your employer.
Yeah.
And what we have found is a lot of employers incorporate this as part of their employee wellness benefit.
Right.
And so it just flows right with everything else they're already doing to help their employees. And it's a very intimate setting. There's no one on the coach except for the staff and the participant. And so it's not like a big hospital or a
It's not a party.
Yeah, it's not a party. And so a lot of people like that. They prefer that. It's my business. I'm in, I'm out, and I'm on my way till next year.
And 20 is the number for that. So if you're an organization that has 20 women in your organization, or are connected to 20 women in your organization, I think that's fantastic.
Yeah,
So
it's really not that hard. And with some of our smaller sites that like smaller ISDs or companies, once they go through their employee list, if they're still lacking those 20 women, they reach out to their family members. They reach out to church members to fill that.
Right.
So it's really, it's doable.
That's great.
Very doable.
So if somebody wants to set this up, how do they reach you?
The best way is through our mobile phone number, which is 5136, or through our website, which is therose/mobile.org. I had to think about that for a minute.
that's awesome.
Well, as a daughter of a breast cancer survivor and a granddaughter of a breast cancer survivor, I know how important it is to have a mammogram. I have one every 6 months. And I don't look forward to that day, but I know that it's a day that I can help save my life so that I'm around to see my daughter grow up. And I just encourage women that I have so many friends that say, I'm in my mid-40s, and they'll say, I've never had a mammogram. And I'm like, what? This is not an option. And so if you have waited and you're putting it off, please do not wait and put it off, because it really can save your life.
Yes, and I'm amazed when I go to health fairs and things and different events, how many women say, "Oh, I haven't had one in 5 years," or "I've never had one." And
don't do it.
Don't
it
wait.
is. Yes, it's uncomfortable, and yes, it hurts, but it is over, and then you forget about it for another year. Right. And so it can save your life. So do not put this off. Get checked. Get your boobs smashed. It will be okay, and you will forget about it until next time. Save your life.
Correct.
And so much in cancer research, they're saying early detection is the most effective thing that we have against cancer right now. So it's scary sometimes to think about what the result of that might be. I know that, like I said before, I've never had a mammogram, but people that I love have had breast cancer and have had to go through that. And I've seen from conversations with them that you're worried about what the results may be, and so you put it off for that reason. But early detection is so essential.
The earlier
for these
it's
things.
found, the better the treatment and the better the outcome.
My mom's was stage 0.
Mm-hmm.
I didn't even know there was a stage 0.
Wow.
But they found it in a mammogram, and thank God they did.
Yep.
And here she is 6 years later, living her best life. So
I'm sure
go
you
get
guys,
a mammogram.
I'm
Call
sure
the
y'all
Rose.
have hundreds, thousands of stories of
That's right.
people who had
Yes.
early detection like that, and it's truly life-saving
Yes.
for people. So
Well, we appreciate you being here and educating us and letting us share your story with the public. And go out and get a hold of the Rose, set it up, make sure your employees are taken care of, give them time off to get checked. So thanks for being here.
Thank you so much.
Thank you, Brenda. Appreciate your time, and thanks for chatting with us. And thank you so much for listening to the podcast again this week. Do us a favor and share this podcast with someone. Share this with a woman in your life who you think needs to maybe go get a mammogram and have things checked out, and can use the Rose in their mobile mammography units as well. Thank you so much, and we'll see you next week.